patients will ask me, Dr. Svatek, how did I get bladder cancer? Why did I get it? And I often respond with something along these lines, is that the body is very good at getting rid of toxins and environmental carcinogens or toxins. It takes them and it filters them and puts them in the urine. And the problem is that the bladder has to hold the urine until you can find a rest stop. So it's that long contact between the urine, which has carcinogens and toxins, with the bladder that eventually, over years and years, will form or predispose to bladder cancer. And why would I do bladder cancer? Why would I choose this as a subspecialty? Chloe and I were talking about subspecialty selection just a second ago. And in many ways, it's not an attractive subspecialty. A lot of people don't want to do it. The reason for that is because the surgeries are exhausting. They can take up to 8 hours, and the patients are often very sick and have to stay in the hospital a long time, so it's very stressful. And we have all that, but yet we don't get the recognition that the transplant surgeons get. So, but the patients are very are wonderful, and the return on the patient is important. But really, for me, honestly, the reason that I chose this field was a very specific finding, a very specific thing that happened to me, an experience in my training, early on in my training. And it really changed my life completely. Because before I went into training, I had no research experience. I had not one paper. And this turned my life 180 degrees around. So we were treating bladder cancer, and we still do, with a medication called BCG. It's been out since the 1970s. And I witnessed a patient who had been treated. This patient had a superficial form of bladder cancer. And if you looked into the bladder, I saw this red patch. We describe it as a velvet carpet. And it occupied the entire surface of the bladder. If left untreated, this would have advanced to a very aggressive tumor and metastasized, and it would be deadly. We put BCG in once a week for 6 weeks. And 3 months later, I looked back into that bladder, and it was remarkable. I remember it very distinctly because I took pictures, and the bladder was completely normal. It had completely changed to a normal-looking bladder. And I was just struck because I thought, this is a magic pill. Why can't we treat all cancer with this? I mean, this is perfect. So that night and that week, I spent hours reading the internet. And I became engrossed with this. I spent all my time studying. And once I finished the internet search, I went to the library and pulled up all the old BCG papers. In a year, I become really an expert in BCG immune therapy and bladder cancer. And I wanted to find out why we can't use this better and why it can't make a difference for other patients. So now, fast forward to today, I have a practice which it's a dream practice for me because I take care of all bladder cancer patients, and I have a laboratory that is devoted to identifying why BCG works and how we can make it work better. The two problems are, one is, why doesn't it work better? And why can't we use it in other cancer types? And number two, why do some patients not respond? And that's what we're trying to figure out. Do I have one more minute? Or okay. So I want to say one thing is...
Rob, 1 more minute.
I think, why does BCG work and what is the phenomenon here? And that, I think, is really exciting. Our immune system is what's really working, and BCG just helps the immune system to work better. Right now, as you and I sit here, our immune system is identifying cells that don't look right, that look foreign, and they're just eradicating them. And tumors happen because the immune system was evaded. It somehow evaded the immune system. And so what BCG does is it returns the normal function of the immune system, and it's remarkable at doing it. And I think that the immune system is a remarkable tool to fight cancer of all types. And that's why I'm devoting my life to studying that. So,
thank you, Rob.